Good morning, everyone. Thank you for joining us today. Please remember to mute your microphone if you are not presenting. I'm just checking. Lori, can you see the waiting room before we kick off here?
Yes, I can.
Perfect.
Can I just do admit all again, or do I just?
Yep.
Okay.
All right, we're gonna wait just another few seconds here.
I'm sure it's not. I know, but that's always my justification to finally just throw it away.
All right, we will go ahead and get kicked off for today. Thank you all for joining us for the South Dakota Project First Lines office hours for May. Our topic today will be hand hygiene. I am Jess Stanko. I'm a program director at the South Dakota Foundation for Medical Care. Also with me today, I have Mindy Hoyer. Mindy, do you want to give a brief introduction?
Sure. Good morning. I almost said good afternoon. Good morning, everybody. My name is Mindy Hoyer. I am one of the South Dakota Project First Line team members and glad to have you here.
And also from South Dakota Foundation for Medical Care, we do not have her up on the screen, but Lori Hintz is joining us today to assist us with today's presentation. Rebecca Syme is no longer with us and has moved on to new adventures and opportunities. So Lori is assisting today. All right, this slide is a slide that comes from us from the South Dakota Department of Health, and it really just highlights the importance of public health, what it is, and really how all of us work together, whether we're in a school system, a healthcare system, an emergency management area, working together to really provide public health for the entire state of South Dakota. This contract and presentation today is brought to you by the South Dakota Department of Health HAI program and is available through the funding through the CDC SHARP. Just a couple reminders as we kick off the presentation today. Make sure that you engage and ask any questions throughout the presentation. You can place that in the chat or the comments section. We really encourage that. If you have resources or links that you like to use as we're talking through today's information, please feel free to share those as well. We will share out the recording afterwards that will go onto the website and also out in our email. There will be a survey at the end. Please remember to complete that. We really appreciate that feedback that allows us to report back to the Department of Health as well as to the CDC. From here, I am going to turn it over to Mindy.
Okay, thank you, Jess.
Yep.
So, as we said before, today's topic is hand hygiene. Do we have to talk about hand hygiene again? And yes, I think it's something that it's good reminders for all of us that work in healthcare. So today our objectives are what is hand hygiene? Where are those risks, with our patients in the environment that we work in? And then prevention, how to perform hand hygiene, and then also hand hygiene and glove use. Next slide, please. So just a little info on Ignace Semmelweis. I think I said that correct. He is known as the father of hand hygiene. So in 1847, he observed that the mortality rate for women giving birth in a maternity ward was much higher than the midwife run ward. He noticed that doctors and medical students often visited the maternity ward after performing an autopsy. So he hypothesized that particles from the morgue were getting into the hands of doctors and into the bodies of women during childbirth. So what did Ignace do? He ordered doctors to wash their hands and instruments in chlorine solution. The mortality rate for new mothers dropped from as high as 18% to about 1%. His intervention is considered a model of driven strategies to prevent infection. Hand washing is now viewed as one of the most important barriers to cross-infection. Next slide, please. So this is a visual from an article in Sage Journals, rigorous hand hygiene practices among healthcare workers to reduce hospital-associated infections during the COVID pandemic. These charts highlight the direct correlation between hand hygiene and HAIs. So as you can see there, hand hygiene is in the blue. The MDROs are in the orange. That's the line going across. And then device-associated infections is in the green. So we just kind of liked that visual for people to kind of look at to see how things are trending down and how hand hygiene is getting better and better with each year. So next slide. This is a visual of sanitizer consumption bottles from October 2019 to April 2020. Here we see that when hand sanitizer is more accessible, it can increase compliance of hand hygiene, which can reduce HAIs as we previously discussed. Next slide. So how do germs spread? So transmission is a way of germs. Hold on a second. Let me go on to the next one. So there are 5 elements of how germs spread and cause infection. These are reservoirs, pathways, a person to infect, getting around the body's defenses, and survival. Infection control actions at any one of these key points stops germs from spreading and causing infection. The main pathways for germs to spread in healthcare are touch, breathing in, splashes or sprays, bypassing or breaking down the body's natural defenses. Germs need a pathway to be spread out of the reservoir where they live. Germs also need to be delivered to a person, get around their body's defenses, and infect them. Germs also need to survive in an environment while they spread to be able to cause an infection when they reach someone. And infection control actions at any of these points keep the germs from causing infection. Of course, there are more pieces to the puzzle of germ spread than reservoirs and pathways. Germs also need to arrive at a new person. That person could be a patient, or it could be you or one of your colleagues. And in order to infect them, the germs need to get around the person's natural defenses. If the person is already sick, then their immune system could be weak and not able to fight the germs as well as a healthy person can. If their skin is broken from having an IV inserted, for instance, germs can enter their body through that break in the skin defense. Throughout all of these elements, the germs need to survive in the environment if they're going to make someone sick. That's called being infectious. The infection control actions that you take at any of these points help keep germs from spreading and causing infection. Now we're going to use what we know about reservoirs, pathways, and how germs make, excuse me, people sick to discuss a scenario. All right, so recognizing these reservoirs and pathways. When we think about risk in infection control, we think about seeing the possibility that something bad might happen, that a germ could be spread and infect someone, and taking action to keep it from happening. As we explore the idea of recognizing risks for germs to spread in healthcare, it's helpful to start with where we find the germs. Where do they live? Where are the reservoirs? We can then think about how they get from place to place or to other people. What are their pathways? In healthcare, we think about germ reservoirs in the human body and in the healthcare environment. Reservoirs in the human body are the skin, the GI tract, the respiratory system, and blood. Reservoirs in the healthcare environment include water and wet surfaces, dry surfaces, dirt and dust, and devices. There are a few common pathways for germs to be spread from reservoirs in healthcare. Those are by touch, when they're breathed in, through splashes and sprays to the eyes, nose, or mouth, or to broken or unhealthy skin, and through things we do as part of healthcare that bypass or break down the body's natural defenses. For instance, procedures and surgeries that require breaking a patient's skin can allow germs from the patient's skin to get into their body. Anything that we do that involves touch, whether it's touching a person or things in the environment, like blood pressure cuffs or tongue depressors, can be a risk for germs to spread. Next slide, please. Germs are present on patient's skin. Nearly 1 million dead skin flakes containing viable germs are shed daily from normal skin to a patient's immediate surroundings, such as the bed linen and furniture. These and other objects in the environment become contaminated by patient germs. They surround patient surfaces that may be contaminated by a patient's own germs or by other people's germs and by inanimate objects. Healthcare worker hand contamination. So we got direct and indirect contact. Patient germs contaminate healthcare workers' hands. Healthcare workers' hands become contaminated by touching germs present on patients, medical equipment, and high-touch surfaces. Healthcare workers can carry the germs on their hands and can spread germs when proper hand hygiene is not performed. Germs survive and multiply on healthcare workers' hands. When proper hand hygiene is not performed after contact with patients or their environment, germs can survive and increase in number on healthcare workers' hands. Hands remain contaminated if hand hygiene is missed or poorly performed. When hand hygiene opportunities are missed, or when hand hygiene is performed poorly, hands remain contaminated with germs. Poor hand hygiene occurs when an insufficient amount of product is used or when there is an insufficient duration of hand hygiene action. Transient microorganisms are still recovered on hands following hand washing with soap and water, whereas hand rubbing with an alcohol-based solution has proven to be significantly more effective. Transmission from one patient to another via healthcare worker hands. So transmission occurs when healthcare workers with contaminated hands come in direct contact with another patient or with an object that may come into direct contact with the patient. Touching invasive devices like urinary catheters, IV lines, or respiratory tubes, for example, with contaminated hands may cause infections. So here's a question for you all. What is the single most important reason for healthcare workers to practice good hand hygiene?
You can go ahead and put your answers in chat and Lori will let us know what the consensus says.
So far, all the answers are D, to prevent infections that patients acquire in the healthcare setting.
Yes, absolutely. The single most important reason for healthcare workers to practice good hand hygiene is to prevent infections that patients acquire in the healthcare setting. But all answers are good reasons to practice good hand hygiene. Improved adherence to hand hygiene has been shown to terminate outbreaks in healthcare facilities, reduce the transmission of antimicrobial resistant organisms, and reduce overall infection rates. So the 5 moments for hand hygiene. So hand hygiene is the #1 intervention to protect your patients from a healthcare associated infection. So in addition to doing hand hygiene upon entering and exiting a room, incorporating the World Health Organization's 5 moments of hand hygiene while caring for our patients assures them that all the healthcare workers are engaged in a culture of safety. The most effective way to ensure optimal hand hygiene is by using an alcohol-based hand sanitizer. It is the preferred means for routine hand antisepsis. Performed hand hygiene with soap and water when hands are visibly dirty or soiled with blood or other body fluids, when exposure to potential spore-forming organisms or after using the restroom. The indications for hand hygiene are independent of those that justify the use of gloves, whether sterile or non-sterile. Glove use neither alters nor replaces the performance of hand hygiene. So before patient contact, performed hand hygiene before touching any patient. Clean your hands before touching a patient to protect them against harmful germs carried on your hands. So examples would be shaking hands, helping a patient move around, getting the patient washed up, taking their pulse, doing a blood pressure, chest auscultation, or abdominal palpation. Before clean aseptic procedures. So clean your hands before assessing critical sites with infection risk for the patient to protect the patient against harmful germs, including the patient's own, entering his or her body. So an example would be like brushing the patient's teeth, putting in eye drops, skin lesion care, wound dressing changes, catheter insertion, preparation of food, medications, and sterile materials. After body fluid exposure risk. Clean your hands as soon as a task involving exposure to risk to body fluids has ended and after glove removal to protect yourself and the healthcare environment from harmful germs. So examples of those would be brushing the patient's teeth, skin lesion care again, wound dressings, administer injections, clearing up urine, feces, or vomit, handling waste like bandages, napkins, incontinence pads, and then cleaning of contaminated invisible soiled material or areas. So like your soiled linen, bathroom, urinals, bedpans, medical instruments. After patient contact, clean your hands when leaving the patient's side, including after touching a patient and his or her immediate surroundings to protect yourself and the healthcare environment from harmful germs. Examples of these would be shaking hands, stroking a child's forehead, washing a patient, applying an oxygen mask, taking a pulse, blood pressure, abdominal palpation, any of those things. After touching the care environment, clean your hands after touching any object or furniture in the patient's immediate surroundings, even if you haven't touched the patient, to protect yourself and the healthcare environment against germs. So examples of that would be changing the bed linen with the patient out of the bed, IV perfusion adjustment, monitoring an alarm, holding a bed rail, leaning against the bed, clearing the bedside table. Okay, another question for you guys. Which hand hygiene method is best at killing bacteria?
Okay, the majority are saying C, alcohol-based sanitizer, but there's also B,
Okay.
microbial soap and water.
Okay, so the answer is C. Alcohol-based hand sanitizer is the best method at killing bacteria. According to the Healthcare Infection Control Practices Advisory Committee, hand hygiene guidelines, an alcohol-based hand rub is the best at killing bacteria. An alcohol-based hand sanitizer is the preferred method for cleaning your hands when they are not visibly dirty because it is more effective at killing potentially deadly germs on hands than soap. It is easier to use during the course of care, especially when moving from soiled to clean activities with the same patient or resident, when moving between patients or residents in shared rooms or common areas. And it also improves skin condition with less irritation and dryness than soap and water. All right, so when to perform hand hygiene. So with soap and water, you want to use soap and water when hands are visibly soiled. So whether that be blood, God only knows what you get on your hands taking care of a patient before eating, after using the restroom, excuse me, during the care of patients with suspected or confirmed infection during outbreaks, when to use hand sanitizer. Unless hands are visibly soiled, hand sanitizer is preferred over soap and water in most clinical situations because it is more effective at killing germs on hands than soap. It is easier to use, especially when moving from soiled to clean activities on the same patient or when moving between care of patients in shared rooms. Results in improved skin condition with less irritation and dryness than soap and water, and improves hand hygiene adherence. Okay, how to perform hand hygiene. So if you're using the alcohol-based hand sanitizer, put the product on your hands and rub hands together. The effectiveness of alcohol-based hand sanitizer depends on the volume applied to the hands. Use the right amount of alcohol-based hand sanitizer product to clean your hands. Cover all surfaces and rub until hands feel dry. This should take around 20 seconds. Pay attention to the areas providers frequently miss, and that is the thumbs, the fingertips, and between the fingers. How to perform hand hygiene with soap and water. So you want to wet your hands with the water, apply the manufacturer recommended amount of product to your hands, rub hands together vigorously for at least 15 seconds, covering all surfaces of the hands and fingers. Rinse hands with water and use disposable towels to dry. Use a towel to turn off the faucet. Avoid using hot water to prevent drying of the skin. Other entities recommend cleaning hands with soap and water for at least 20 seconds. Either time is acceptable. The focus should be on cleaning your hands at the right times and scrubbing hands and fingers with soap. Hand hygiene product efficacy. So using hand sanitizer every time there is an indication for hand hygiene unless your hands are visibly soiled. According to the CDC, alcohol-based solutions are more effective than washing hands with plain soap and water. Alcohol-based solutions reduce bacterial counts on the hands more than antimicrobial soaps or detergents. Nails and jewelry. Natural nails should not extend past the fingertips. Do not wear artificial fingernails or extensions when having direct contact with high-risk patients like those at intensive care units or operating rooms. Germs can live under artificial fingernails, both before and after using an alcohol-based hand sanitizer and hand washing. Some studies have shown that skin underneath rings contain more germs than fingers without rings, and further studies should determine if wearing rings increases the spread of deadly germs. Hand hygiene and glove use. So when to wear gloves? According to standard precautions, when you anticipate contact with blood or other infectious materials, mucous membranes, non-intact skin, potentially contaminated skin or equipment, gloves are not a substitute for hand hygiene. If your task requires gloves, perform hand hygiene before donning gloves and touching the patient or the patient's surroundings. Always clean your hands after removing the gloves. And remember to remove gloves carefully to prevent hand contamination, as dirty gloves can soil hands. When to change gloves and clean hands. If gloves become damaged, if gloves become soiled with blood or body fluids after a task, if moving from work on a soiled body site to a clean body site on the same patient, or if a clinical indication for hand hygiene occurs, if moving from care to one patient to another patient, if they look dirty or have blood or body fluids on them after completing a task, and then before exiting a patient room. So in summary, hand hygiene reduces the incidence of healthcare associated infections. Remember your 5 moments of hand hygiene. Follow proper technique when performing hand hygiene, and alcohol-based hand sanitizer is the preferred method for hand hygiene. Next slide is our references. And then any questions or comments for the team?
You can come off a mute if you would like, or if you have any questions, you certainly can place those in chat. Lori, are you seeing anything in chat?
Nope.
All right, if you guys have any questions, please feel free to still place those in chat or come off a mute. We will go ahead and continue on here. This is the QR code that will allow you to answer the survey questions. Like I said, it will also pop up here at the end of the webinar. So please provide that feedback for us. It is very, very helpful that we have that and share it on to the Department of Health so they can continue the work with the Project First Line initiative. Also on the website, there are these resources available. This is the QR code that will take you there. One of the big opportunities available is the continuing education credits. Those are available for free for dental EMS, CHW, OTs in South Dakota. So if you are looking for free continuing ed credits, please visit our website. You can use this QR code and that will allow you to obtain those. Also on here are the resources such as these posters, microlearns, assistance with things like respiratory viruses and what to do. These resources are provided both in English and Spanish, so if you have a need for Spanish materials, those are available also. This last slide that we have today to share with you is a photo of Sherry Fast. She is with the South Dakota Department of Health, working in the Healthcare Associated Infections and Antibiotic Stewardship Program. Sherry will be, after May 31st, taking care of the majority of the Project First Line initiatives, trainings, education, also things like ICARs that maybe some of your facilities have had us come in and do. You will reach out to Sherry for opportunities to obtain any of that. In the chat, we did provide a link to request training, whether that's Project First Line, educational resources. If you need an ICAR, you can request it through that link, and then Sherry will work with your facility and reach out to the appropriate party to provide that training or education, or provide that directly from her. If there are no other questions, we want to thank you again for joining us today. This will be our last office hour session. The contract is changing, and with funding sources in that, we will no longer continue with the Project First Line office hours. So you will see a cancellation come through of the remaining events that may have put on your calendar hold.
Yes, this is Sherry. Can I say something?
Absolutely. I'm glad you're on.
So on behalf of the South Dakota Department of Health, I just really want to take the opportunity to thank the South Dakota Foundation for Medical Care for all the work that they have done with the CDC's Project First Line. The dedication and effort made a big impact in promoting infection prevention across South Dakota, and I appreciate everything that you guys did. For those of you that don't know, over the course of the last 4 years, South Dakota Project First Line was recognized by the CDC on actually multiple occasions. One, when we first started, it was for our learning needs assessment. We were tasked with finding out what South Dakota needs were, and we received over 1,900 surveys back from that, one of the highest in the nation, actually, for getting returned responses. And because of that, that has allowed us to continue in areas where other states were not granted those permissions. And so that was really a milestone, I would say, for South Dakota Project First Line. The other was we created I should say we, because I feel like I'm still part of the team. We created a game, an outbreak game. We did a scavenger hunt. All of those things were really recognized by the CDC as innovative and creative ways of getting learning out there. With that being said, all of those things are still going to be available to you all. We are in the process of switching South Dakota Project First Line website over to the Department of Health. So just bear with us. You will still be able to access it for a couple months yet until we get everything moved over. The other thing I want to just mention is the foundation did a great job. They developed newsletters. They have these monthly office hours, which I think were so informative for you guys. And hopefully we can continue that. I'm not sure what that all looks like going forward yet, but if you have ideas, make sure you reach out and let me know. So again, thank you to the foundation. And scary and hard times, sometimes we have to be faced with making decisions. So
Thank you, Sherry. It's been fun work and a fun project, and it's been great to be able to work with the healthcare facilities, you guys that are on the call today, to really provide resources and education and come into your facilities each month and really be able to connect. So thank you for joining us. All right, we will go ahead and wrap up our call today. Again, thank you, everyone. It's been a great pleasure to work with all of you, and reach out to Sherry. She's still available for any of your needs, resources, education, ICARs, etc. Thank you.